Good afternoon, and thank you very much for listening. Today, I cannot be more thankful to my favorite tri-state orofacial myology community, as well as CBS News, and specifically investigation journalist Anna Werner, as well as news anchor Gail King for presenting this episode on temporomandibular joint disorders and ineffective treatment, because that's really affect a lot of Americans. It's such a common problem. I totally agree with the numbers, and I see this every day in my practice. Important fact, which was brought up on that presentation, was not much knowledge about this surgery or in general for treatment of temporomandibular joint disorders in a medical or dental community. And thank you very much to my audience. If you have trouble sleeping or sleep next to the snoring partner, I just want you to know what 52% of people with sleep apnea have temporomandibular joint problems. And if you're a medical professional who, just like us, trying to uncover the puzzle of temporomandibular joint symptoms, reasons, as well as a strategic treatment, please click the like and share button. So going back to this presentation, and I'm so thankful what they illuminate the fact what the surgery have to be the last resort. And it's not so many people, it's not so many cases, surgical cases in the country in general, because it's such a complex problem. And this joint we use in most important life functions, such as in eating and drinking, and we can say breathing as well as in the case of internalizing stress, we also use the temporomandibular joint. I want to touch the fact why temporomandibular joint is so different from any other joint. That's the jawbone and the skull has 4 muscles connecting these 2 bones: temporalis, masseter, medial pterygoid, and lateral pterygoid. And in the middle of the joint, there is a very special structure, disc, and which make the joint function very smoothly, as well as it's provide the nutrition for the bones. The most important fact, what the masseter bone, which connect the skull and the jawbone, is the strongest muscle in the body. And we also use the joint, just like I mentioned before, for eating, swallowing, speaking, and breathing. And I like one of the people I highly respect, and she's going to have an interview on our channel, Dr. Priya Mistry. She talk a lot about mystery of temporomandibular joint and give a very good strategic advice. What are the reasons for temporomandibular joint disorder? Of course, it can be as acute as trauma. If somebody got into the car accident or another type of accident and joint misaligned and bones are out of alignment, of course, in that case, surgery is absolutely necessary to put the joint in the correct alignment and a position. But what's very important after the surgery is done, rehabilitation therapy. And that rehabilitation therapy is a long period to establish the correct muscle function. Function define the form. And usually the therapy have to be done with physical therapists as well as myofunctional therapists. And this way, the correct habit can be established and tongue can have enough muscle strength to support that newly aligned jawbone and the joint. And besides the acute way, it can be more chronic way what lead to temporomandibular joint trauma. First of all, I would like to mention about orthodontic treatment. Very often I meet people in my practice who complain on the pain in the jaw joint after orthodontic treatment. There is a certain way. I highly believe in orthodontic treatment, but if it's a retrusive orthodontics or 4 bicuspid were removed, very often those people will have pain in the jaw joint. Also, I want to mention unaddressed tongue thrust. That's a habit when people use the tongue and put it between the teeth, as well as the tongue tie unaddressed. In that case, tongue is really weak and it cannot support the jaw joint in the most balanced position. But the most common situation what I witnessed during 25 years of addressing pain in the jaw joint, I would say clenching and grinding of the teeth. I can call it self-inflicted situation, according to research. And we can see it in practice if we get into the stressful situation. Of course, we can do the fist, but most often people clench the teeth, and that can lead to the muscle spasm and damage to the disc of the temporomandibular joint. And as well as at night, research shown what 75% of the people who have temporomandibular joint disorders have sleep and breathing disorders underlying. What exactly happened? During the night, when people get into obstructive episode and they cannot breathe, they move the jaw forward out of the position to open the airway and continue breathing through the night. That time, they move it on the teeth. It's a very strong muscle movement, and they wake up with a headache in this area. And that headache usually very specific for patients with a sleep apnea. It's last 10-15 minutes in the morning. So if you or someone you know complain on that morning headache, it's a really good idea to have a sleep study done to find the reason for that headache. I have to admit, there are a lot of different body reaction to the clenching, grinding of the teeth, to the bruxism. A lot of people, they break their teeth. So we see fractures, and especially during the COVID time, it was like a, pinnacle. It was a constant, every day we got a phone call, somebody broke the tooth. It doesn't happen in a everyday time. It was really unprecedented situation with the vertical fractures of the teeth. Number two, when people grind the teeth, they put a lot of stress on a bone, and a bone respond with the growth. It can be on a top jaw in the middle of the palate, or it can be on the bottom. That's a bone growth. Also occupy the tongue space, which can lead to additional breathing difficulties. And third group of people, they have full pain in the jaw joint. It can be muscle spasm, so limited opening of the mouth, also limited movements to the side and forward. They have a lot of pain in the jaw joint, and you have to remember that this jaw joint is next to the ear. That can be some hearing problems and hearing loss, or vertigo. It can be dizziness because the balance mechanism right next to the ear, as well as a lot of nerves run exactly in that area. So the symptoms can be very different. Some people can experience pain in the neck, in the shoulders, in the spine. And I have to also, I've seen much more extensive way of symptoms. It can go to the shoulders and to the hands. So it's all can be related to TMJ problems, as well as they can be nauseous. So a lot of nerves in that area can lead to very different bouquet of symptoms. Now that $1 million question, why more women, 9 times more, have these symptoms than men? And there are 3 reasons what I found according to scientific literature. Reason number 1, fluctuation in estrogen hormonal mechanism in women before the menopause can relate and can lead to the problem in the jaw joint, to the pain and symptoms in the jaw joint. Number 2, more women have a internalized anxiety. And as a result of it, clenching and grinding of the teeth. Clenching and grinding of the teeth, as I mentioned, lead to the muscle spasm and increased load to the jaw joint. And number 3, a lot of women have sleep and breathing disorders, but different from men, they don't snore. Women become tired and depressed, and many times they go undiagnosed. I want to bring another scientific fact. Research shown that 87% of people with the sleep and breathing disorders are undiagnosed. And women not necessarily might have a sleep apnea. They can have upper respiratory resistance syndrome, which lead to breathing difficulties, but not full obstruction, but it can be reflected with the symptoms in the jaw joint. And I appreciate the fact that CBS News illuminate the fact that more women suffer from their disease than men, and a full social media complaints from women how they cannot find help to the symptoms. And I really appreciate what they illuminate the surgery. It's a very traumatic way to look at those slides, but this is true. A lot of people look at the surgery as a magic wand. They think what if oral surgeon gonna get in a jaw joint, clean the inflammation, then pain just disappear. But in reality, it doesn't happen this way. Of course, it needs a lot of supportive therapy. I'm talking about physical therapy to make a muscle stronger, myofunctional therapy to make a tongue and these muscles stronger, because function defines the form. But very often, from my practical experience, I notice people start with the most conservative surgery, and every 6 months or every year, surgeon go back. I hope it's not as often, but I've seen cases when it goes to more and more invasive approach. And it's very heartbreaking to see these pictures and hear how people suffer. But I think the message about surgery, if you can avoid the surgery, please do that with conservative therapy. And the surgery is not a magic wand. And after surgery, you need to have a lot of supportive therapy for the muscles to keep the joint properly supported. So what do we do if somebody comes to our practice with temporomandibular joint pain? And we have 2 different lines of approach. Let's start with the emergency approach. If somebody comes to us, we do the proper diagnosis with exam, with x-rays. We have 3-dimensional x-ray, and then we discuss that emergency therapy, which consists of several things. Number 1, very important principles: lips together, but teeth apart. Number 2, during that time, people have to be on a soft diet to put us the least amount of stress on the jaw joint. Number 3, we teach them different aspects of myofunctional therapy, such as keeping the tongue on the roof of the mouth to support the joint. Otherwise, joint is very unbalanced if tongue is not in the middle. So we recommend to keep the tongue like this. We also have that monkey exercise we teach the patient how to do, to move the tongue on the top of the teeth and behind the lip like this, and keep it for some time. That's kind of a beginning to relieve if they can. Also, we do splint therapy. It can be different designs of splint. It can be immediate flat splint in the front or soft splint like Aqualizer. In my interview with Dr. Joe Gaudio, we discussed that emergency treatment. Some people suggest Botox. Yes, we do Botox in our practice, but I don't recommend that Band-Aid, which not gonna last for longer than 4 months, just to relieve the patient. I think it's a really significant expense. And some people, just like Dr. Gaudio, use the laser therapy to relieve or eliminate inflammation in the muscles and relieve the joint. And after emergency period pass and patient not in pain anymore, we discuss more strategic approach, how to prevent those acute periods from happening. And again, we have two component of our therapy for temporomandibular joint disorders. Of course, after it's proper diagnosed, and sometimes we have to send patients to radiologists for more extensive tests. But in a lot of cases, we offer splint therapy 24/7. But number one, in that case, before we start discussing long-term solution for the jaw joint, we refer patient for sleep study to the medical doctor to eliminate sleep apnea. As I mentioned, research shown that 75% of people with temporomandibular joint disorders have an underlying sleep apnea, and we want to eliminate that or treat sleep apnea and TMJ together. According to another wonderful interview I had on my channel with Dr. Jamison Spencer, he said that the best guard, according to research, is mandibular advancement device, which address sleep apnea and TMJ in the same time. So if patient doesn't have a sleep apnea, then we offer them splints 24/7, one splint for the night for the upper jaw and another one during the day for the lower jaw to keep the bite balance. And we offer myofunctional therapy to reach 4 important goals: to make lips strong, what they can stay close, so patient can breathe through the nose 24/7. That slow nose breathing activate parasympathetic nervous system, which also relieve pain in the body in general. And we work a lot on the tongue muscles for patient to be able to keep the tongue on the roof of the mouth to keep joint balance, and also use only tongue during the drinking and swallowing. So this way, tongue constantly keep joint balance in the middle. Otherwise, I like that from my myofunctional therapy mentor, Sarah, that analogy where she said, it's like 2-leg stool without the third leg. It's constantly moving. So that's, very visual reason for temperament. But most important part, we constantly educate patients and refer to a lot of collaborators, myofunctional therapists, and I interview a lot of them on my channel, and physical therapists who have a certification in temporomandibular joint disorders, like I interview Carol Cott or Bella Kavalerchik practice in New Jersey. That's our collaborators, as well as a lot of myofunctional therapists who highly believe in that treatment. And they are also on our channel, like Miss Nicole Tabun, Agnieszka Beckford, and Judy Dember. And in New York, I interview Michal Nidzievsky, physical therapist, and Dr. Yohi Takada. They are graduates from Postural Restoration Institute, and they have a lot of emphasis on TMJ treatment. So if you have a chronic pain, please look for several different opinions from different specialists, such as osteopath, chiropractors, acupuncturists, craniosacral therapists, myofunctional therapists, and physical therapists with the proper certification. And some patients who were referred to our practice with the different symptoms, they were referred, it's a collaborative treatment with the physical therapist. So this patient, he said very strange phrase, said, I'm not grounded. But when the physical therapist sent him to us, he said, but this patient has uneven bite, even though it seems even, but it's uneven bite, and he asked to do the splint. So we do the splint, but patient can wear 24/7 to have equal loading on both sides of the jaw. And when the patient moves the jaw forward, it can only touch in the front of the guard, so back teeth don't touch. After we did the guard, we evaluate him together with the physical therapist. And he said what the fascia for that patient feel so much more relaxed. And I mentioned in my previous program what fascia start on the tongue and finish on the toe, on the feet. So this patient originally was walking just on his toes without touching the heel with the ground, or at least it feels like that. After we insert the guard, he was able to really walk on the feet, in a range of motion on a lot of joints will improve. And this is another patient who we did collaborative treatment with a physical therapist. This patient has a lot of tightness on the left side of the body, and he cannot move the jaw to the right side. It was a very small range of motion. So after we insert the guard, this patient feel, after 5 minutes, it was almost like a miracle to me. After 5 minutes, he feels significant relief on the left side of the body, and he was able to move the jaw to the right side, same distance as he moved to the left. Those miraculous cases really make me so inspired, and I highly recommend other dentists to collaborate with a physical therapist and myofunctional therapist on TMJ treatment for those patients. And just like on CBS News mentioned, this is the way how we can eliminate the need for surgery, hopefully, if we establish proper function with the muscles. And again, I cannot be more thankful to CBS Morning News, as well as Anna Werner and Gail King and the other part of the team who brought this very sensitive topic to the television, and topic was so close to my heart. I highly believe what this collaborative effort can make TMJ issue not as mysterious and definitely less dangerous. So thank you very much for listening. If you have a question, put them in the comments, and I really appreciate if you can send the link of that video to people who suffer from temporomandibular joint disorders so they can find the proper help.